Well, street medicine, I guess strictly defined, would be the delivery of health care to those who are living, sleeping on the streets. It's like an onion. The more you peel it, you realize that it's a philosophy, it's social justice, and its effectiveness, and ultimately it's community building.
Street medicine is, I think, an extension of traditional medicine in which the clinicians and the teams of workers, clinical workers, doctors, nurse practitioners, physician assistants, nurses, community health workers, formerly homeless people, head out to deliver care directly on the streets where people are living. And that can involve, on down back alleys in big cities, under bridges. It can involve in rural areas when you go find people living in encampments. But to me, street medicine is when you really get out of the traditional clinical settings and out of the usual four walls of a building and out to see people where they're living, rough outside.
I suppose people going out to take care of people who are in need in a mobile way is ancient, but it's become a recent movement. And there's a number of us who got involved probably back in the 80s and the 90s. And we've managed to kind of bring together support for that kind of activity. And it's actually snowballed quite a bit in the last 10, 15 years, so that there are communities throughout the country, throughout the world that are now doing it.
Stems, I certainly know in 1985 when I first started this as a full-time career pursuit, that we were taking care of people in our hospital clinics, and then we're reaching out and doing shelter-based clinics, seeing people in soup kitchens. And in Boston, what we started to realize is even though we were seeing thousands of people in those settings, it was a group of really hardy individuals, very feisty, very independent, who were not coming into the shelters, but preferring, for whatever their reasons, to stay outside where they can be more independent. And so we started going out in 1986. I remember there was a van in Boston that started to go out at night from 9 at night till 5 in the morning. And that was when we first started saying we're taking medicine to the streets and calling it street medicine. I don't think we were smart enough to make a definition of it or anything, but I think that was the first time that came into my consciousness anyway.
My work with street medicine, which didn't have a name at the time, stemmed from my work as a teacher, as a person in medical education. My thoughts percolated for many years on this, and I think a lot of different experiences, overseas work, even going back to it as a kid doing house calls with my dad, a lot of work with domestic violence. Those things sharpened my thinking to realize that we needed some way to learn how to get closer to the actual reality of the people we serve. That was a skill that might be learnable. Certainly it's one that we need to learn, because so many people, their health is in the context of what they're going through as a person, and groups of people have that as well. I did a lot of overseas work to try to get that lesson, but I realized that for me, the only way to do it at the level I wanted, and also to challenge my own health system, was to do it in my own community.
I had always been involved with some sort of voluntary services, and Mimi Doohan connected with me and started talking about a volunteer, grassroots physician organization to help homeless people, and it just touched me, and I thought it might be a great thing to do.
Well, that's a good story. Actually, I picked up an Independent, which is a local newspaper here in Santa Barbara, and they had an article about Dr. Mimi Doohan in it, and there was a wonderful picture of her, and she was on her knees ministering to a homeless individual. I had done a fair amount of international volunteer service, but nothing really locally, and thought I should do something locally. Thought that instead of having to go out of the country, there should be something right here in our own community for me. And so I called up. I saw that another physician besides Mimi, Dr. Bob Gaines, was also involved. And I had worked with Dr. Gaines, 30 years prior, in the hospital when he was a young resident and I was a young nurse. So I contacted Dr. Gaines and said I had seen his name in the article, wanted to talk to him a little bit more about the organization to see if it was a fit for me. And the rest is how I got started.
I became a priest back in the 70s, and long story, wasn't born to it, didn't come here to UCSB for this, that's for sure. Another long story, but have served as a priest in several capacities, but chaplaincy is probably the best way I could describe what I do.
And then over the next several years, there were lots of programs around the country that were struggling with how do you reach out to the people living on urban streets. And a good friend of ours, Jim Withers, is a doctor in Pittsburgh, and he started doing this as a volunteer in Pittsburgh in the early 90s. And he's probably the person who's taken the mission and the message of street medicine to the broader community and called a lot of us together.
So I looked around and tried to find a population that was underserved, whose needs were not being met, who were alienated, mutually alienated, that in fact they'd given up. And so the essence of that was that I would be required that if I wanted to work with these people, I had to come to them on their terms. Absolutely. That they weren't going to come to me. So after thinking about this and looking around, I realized that there was a group of people in our city, fairly abundant, who were living under bridges in abandoned buildings and along our riverbanks in Pittsburgh, and that they were the people I wanted to learn about.
We have lots of forefathers and foremothers who have been doing this kind of thing for many, actually for centuries, if we really were to go back to it. But yet, in recent years, Jim Withers, certainly in Pittsburgh, Mark Stinson, his disaster work, and just on and on. And there are many who have kind of come to this as a way of doing things.
I've always worked with groups of people when there's problems like a disaster. I worked with Red Cross during Katrina, gone other places and worked for a couple weeks at a time. And I couldn't figure out how to do it in my own yard, so to speak. So I saw these people with packs one day in the park, sorted out what they were, and lo and behold, Mimi and Jennifer came and talked to our therapy monthly meeting and talked about Doctors Without Walls, and so I was immediately excited to go and volunteer, and I did. My role with Doctors Without Walls is kind of doing whatever I need to do that needs to be done. It started off just giving out socks, and it's evolved to I run the triage table, type in the forms of all the patient encounters, keep a statistical record of them, restock all the hospitality items and the packs and the box, started a sock drive at Sansom, just kind of whatever needs to be done.
My name is Jennifer Perez, and I'm an LCSW. I'm a clinical social work with Doctors Without Walls. I provide mental health support as well as connection to resources for our team. I first got involved with Doctors Without Walls around 2005 when I received an email from Father Jean-Stephen Hedges. He had been sent an email by Dr. Mimi Doohan, our founder, asking if he knew a social worker who was involved with the homeless community and restorative policing and mental health. And he said, "Kid, I think that's you." So I contacted Mimi, and she invited me to a meeting at Cottage Hospital where we sat down with a number of medical providers and began to brainstorm the idea of bringing street medicine to Santa Barbara County.
When I first started with Doctors Without Walls, I started volunteering with the Women's Clinic, and I was still in school. I still had classes on Fridays a lot of the day, and I would go up to Casa Esperanza at about 8 in the morning and do outreach, and I would go do walks along the beach and try to find people or find women to tell them that we had a clinic that day and remind people that there would be a van to come pick them up. And then I would occasionally skip class and come to the clinic and try to help out when I knew they were really in need of volunteers. And from that, I just kind of learned all the different parts and how the clinic was run. And the woman who ran it before me really mentored me and taught me how each thing runs and how you need to deal with volunteers and certain clients and things like that. And now I'm the coordinator, and so now I'm in charge of getting volunteers to go do outreach and having enough volunteers to run the clinics and making sure that we have enough supplies, coordinating with different partner organizations as well as the medical staff.
When I heard about Doctors Without Walls through the underserved medicine class, one of my friends, Scott Obana, had been volunteering for the organization for about a couple of months now, and he just invited me out to go check out a clinic. So I just went out, and it was at Isla Vista, and it was in partnership with the local faith-based organization that was doing a meal sharing. And I went to the clinic, and to be honest, I'd never really interacted with homeless people before. So I was kind of terrified because usually homeless people to me were people that I passed by and didn't really, when you pass by a homeless person and they're asking for change, you just kind of awkwardly walk past them and try to not acknowledge that they're there because it's an awkward situation. So actively going to the clinic, actively going to the meal sharing event where they are was definitely, it kind of is a terrifying experience for me. But thankfully Jess Lee Coley and a couple other the volunteers were like, hey, why don't you sit down with us? We're sharing some food with some of these other homeless individuals right here. And then I sat down and I started talking to some of them, and all that kind of fear kind of like dissipated away. And ever since then, it's been a really kind of life-altering experience in that, I see these people now on the streets and I'm like, it's a lot different. It's not, this awkward confrontation where I'm not trying to talk to them.
I first became involved in Doctors Without Walls about 2.5 years ago. I was a medical assistant at the Isla Vista Clinic, neighborhood clinic, and met Scotty Warren, who is such an amazing person. At the time, she was the women's clinic coordinator, and she introduced me to the clinic, and I loved it. I was able to volunteer there every other Friday. It's actually the second and fourth Friday of every month, and was able to actually talk with patients, and I got a lot of hands-on experience from that.
I heard about Doctors Without Walls from some friends at work at the hospital, and I actually was hiring somebody new, and I was interviewing her for a job at the hospital, and she started talking about her work with Doctors Without Walls, and I thought it sounded really cool, so I hired her, and at the same time I started going out with her and volunteering with Doctors Without Walls. So now she's a scribe, and now I'm a scribe and a volunteer at Doctors Without Walls, so it worked out really well.
Well, Doctors Without Walls, I was kind of there from the get-go here in Santa Barbara. But I had just come back from being down in New Orleans. The first couple days after Katrina, I was down there with law enforcement, and when I came back, shortly after that, just within a few days of that, I met Dr. Mimi Doohan and actually Mark Stinson right about that same time too. And when I came back, I was gushing about the whole way that psychiatrically, medically, spiritually, the folks I saw on the street in New Orleans were a lot like homeless people. And this whole nexus between disaster and homelessness. And Dr. Doohan had these wonderful visionary ideas, Dr. Stinson with his disaster experience. We fell in together at I fell in with them. And I got to tell you, ever since then, that has really come to be a very important part of my life's work.
To be very honest with you, I didn't go to medical school till I was 30, so I was a little bit delayed in my vocation, as my mother would say anyway. But when I finally got to medical school and I was thrilled to have something that I really wanted to do now, my goal was to really sort of get into medicine and be good. And I trained, went to medical school in Boston, then I trained at Mass General Hospital. And I loved medicine, thought it was great. And I spent an exceptionally long time, 1 year on the oncology ward taking care of people with cancer, and I became totally smitten with that specialty. So I was on my way to become a specialist in cancer when in my last year of residency, my chief of medicine called me in, and the city of Boston had just gotten a grant to try to take care of homeless people. And it was a grant that was given by the Robert Wood Johnson Foundation. And they were looking to see if big cities around the country could integrate the care of homeless people who at that time was being seen primarily in emergency rooms, see if they couldn't integrate the care of those folks into the mainstream of the medical systems in each of those cities, so that we could do more primary and preventive care and try to keep them from coming into the expensive and very, very crowded emergency rooms. And so I got recruited by my chief of medicine. I like to tell everybody to imagine that when your chief of medicine calls you in and asks you a question, I think of it as rhetorical now. Whatever the answer is, yes, I will certainly do it. So I chose to do this totally by serendipity, by the insight of someone else, not myself. And so I decided that I would do it for a year. I would delay my fellowship for a year. They were actually engineered that for me. And I went out thinking this would be a 1 year kind of urban Peace Corps or something that would solve my late 60s social conscience. So I was going out to do something that I thought would be good. And that's how I got started.
Doctors Without Walls has 3 clinics. There's one in Pershing Park, one in IV, and one in Alameda. There's also an indoor clinic, the Women's Clinic, which I've gotten really involved with. The Women's Clinic is held indoors at Transition House, and it's the 2nd and 4th Friday of the month. They're all really unique. The IV clinic is nice because I live in Isla Vista and I go to school at UCSB, and the people that we help there really are my neighbors. I see them when I'm in school, I see them when I'm walking around. It's really nice to see these people and actually help them, and then see them later and just have a conversation with them. And I think that's why IV clinic is really nice, especially for me.
I am responsible for all of the administrative side of Doctors Without Walls, as opposed to the program side. I am responsible for all federal and state filings. I'm responsible for fundraising. I'm responsible for writing the majority of the checks to the program administrator, or I'm responsible for insurances. I'm responsible for making sure that all of our T's are crossed and our I's are dotted, and that we stay legal and above board. And I'm also responsible for all of the financial statements that come out of Doctors Without Walls. So any sort of financial information that you may see originated with me. I'm the keeper of the books.
In 1992, I met a guy who's become a good friend of mine who had been homeless himself for 7 years. And I asked him, could I go out with you? Because he was going out and giving people blankets and food. And it was an interesting beginning. He was a little skeptical about a doctor being on the street, but he was willing to give me a try. And so the two of us began making nightly visits in 1992. In those days, I dressed like a homeless person. Didn't tell the hospital, and just slipped out in the night with him. And he showed me the riverbanks and the campsites and people that, they trusted him. And then eventually my presence became known, and I became accepted in the street community. And that's when the journey for me began.
It's been unbelievably gratifying and amazing. It was just initially just a couple people going out without any support, and now it's such a complicated organization, but it's mostly all volunteer. It has the most amazing group of volunteers I've ever seen. Everybody's motivated and loving to each other and to the people, and now we have a complicated backpack situation where we have medical provisions, we have medicines, we have hospitality supplies such as clothing and food, and it's all packed and supplied every week by the volunteers and grants, and Direct Relief is involved with that. And so someone has to transport the packs, someone has to supply the packs, someone has to fill the packs, and someone has to keep track of the packs.
You know what he used last time?
I work as a pack logistician for Doctors Without Walls Santa Barbara Street Medicine. So what that means is during the park clinics and also on street rounds, I manage the packs. So inside of our packs, we have all of our diagnostic equipment, our medications, our wound care supplies, and basically, if the doctor needs something, either to as far as diagnostic equipment or for treatment of a patient, for cleaning or dressing wounds, I know where that is in the packs. I provide it to the doctors. I also manage the supplies in our packs and in our stock room. So I keep track of our inventory. I monitor, expiration dates, make sure that all of our supplies are good quality, make sure that we have everything in stock that we're going to be needing for the upcoming clinics. I handle a lot of the reordering. Just generally make sure that everything is in order and available so that we can, continue with our street medicine operations.
The Women's Clinic offers showers, laundry, lunch, basic necessities that we don't even think about. Things that you wake up and do and you don't think twice about it. But these women don't get to shower maybe for 2 weeks until the next clinic. We also provide toiletry donations, and so in between they may be able to, wash their hair with a little water out of the bathroom sink, or feminine products and clothing donations. I think sometimes people's clothes get stolen, or the environment really wears down on the clothes that they do have. So we like to provide those things. But first and foremost, we are providing medical care. We're there building these relationships and offering these services, but hoping that we'll build enough trust to be able to offer the medical attention that the women really might need.
Well, I think there's always the standard things we see during particular times of the year. I think in the winter we see a lot of more upper respiratory diseases. We see a lot of skin staph infections. I think that's because people are not able to keep wounds clean. They sleep on the ground, or they sleep close to each other. Certainly there's things on the street that we don't like to hear occur, but they do. There's fights on the street, so we might see somebody that's been cut or banged up, bruised up. We saw a woman this last week who'd been abused on the streets. I think that's always an unfortunate reality that we don't recognize. Our women are very, very vulnerable on the streets, and so that's also something that we see. And I don't think that happens necessarily at any particular time of year. That's just something that's ongoing. There's always, we see a lot of, obviously, alcoholism, drug use, and abuse. Those are the things that we see. Can we take care of all these things? Of course not. But can we talk about them? Can we provide some basic medical services? Yes. And of course, with our social worker, we can do some outreach in terms of being able to give them other options.
We operate on limited resources, but in many ways that's part of the drill. We have had to learn to take scarce resources and leverage them, multiply them. Here again, forgive me for getting religious on y'all, but it's kind of an occupational hazard. But it's like Jesus taking bread and breaking it and feeding 5,000. We've had to take very limited medical, financial, and time resources and leverage them, multiply them to do all that we've done. And I think the outcomes, when you look at how little the cost has been, the outcomes are something that the whole bloody country ought to be looking at, because this would make a difference.
So I'd been interested in medicine for a very long time. A lot of my family members are doctors or dentists and things like that. So it's something that kind of always interested me. But I never really had, I guess you could say, a reason for wanting to go into underserved medicine. But by doing Doctors Without Walls and meeting some incredible mentors, Dr. Jason Prstowski, who's become, much more than a mentor. He's like one of my closest friends now. Is one of the most incredible people I've ever met, and his kind of passion for humanitarian and underserved medicine, not just abroad but locally, and for social justice is one of the most. It's one of the most inspiring things I've ever seen. So I'd always been interested in medicine, but doing Docs Without Walls, it's pushed me to apply to medical school even more, fervently, and I talk about in all my medical school interviews, and I'd say it's really the catalyst for what I want to do in the future. It's tough to like put into words kind of how strongly it's influenced me, because before I'd always been like, okay, medicine would be a good career, and now I know medicine is gonna be something that I want to be as a part of my whole life.
What I felt, the passion that I felt, and what happened with me is what's happened with every volunteer in this organization. You start with not really understanding why you're walking into it, and also wanting to get through the fear of it, because it's such a difficult area to deal with. People who are unshelterable, people who have been living in the streets forever and really you don't speak the same language at all, but what you do understand is that they are a child of God, and that they deserve to be healthy, and they deserve to have food, and they deserve to have everything that we have. And just because something or some circumstance in their life may have changed that for them and pushed them into a different direction, it's no reason for us not to be able to reach out and try to bring them back and help as much as we can without it costing all the dollars. The volunteerism of Doctors Without Walls is inspiring. It lifts me to a place that I have never been to before, and it has filled holes in my heart from losses that I've had with such joy that I can totally understand why this organization has grown, and it is what it is today, which is beyond belief. It's just 207 volunteers strong, and to think that it started off with 5 or 6 with a vision is pretty phenomenal, but it's that joy that we get back.
In the beginning, my dad and my mom. My dad was a family doctor, and my mother a nurse. And both of them, throughout my childhood, we worked overseas. I did house calls with my dad. So the idea of going to where people were, dealing with their reality, be it here in the States or overseas, was really organic to my childhood. And I think I carried that into medical school. I think I looked for mentors that had that philosophy. And honestly, in medical education, they're darn few. Much of medical education and healthcare delivery has gotten very much compartmentalized into a rigid structure. And I think my going on the streets was really an individual kind of act of rebellion that I wanted to get out of the lab coat, out of the structure, because it just wasn't natural and fluid and human.
Our street medicine was built on that. If you're out there and see people where they are, a lot of the times you're just saying hello and having cups of coffee or bringing blankets, but then when they get sick or when they need something, you're there to help them, and that's kind of what we built on.
What I really love about the clinic is being able to sit down with the clients, being able to just talk, really get to know them. Some of the women have told me their stories, have told me where they've come from. It's really opened my eyes to something that you don't ever think when you see these people out on the streets. Sorry. Suck. Hold on. It's really great for them to know me by name and for me to know them by name. And, when they're walking out the door at the end of the day and they yell from across the room, like, "Bye, Jamie," like, it really is warming to know that you're doing something so meaningful. really our most valuable resource is our volunteers. It's the people who get involved and then consistently continue to show up and get the work done. And that really is what keeps this organization running, is the people. The involvement that we have from students who bring in new energy every year, and the people who have been here since the beginning continue to provide that continuity to the organization. All of those people and the energy that they bring is important to the continuation of street medicine here in Santa Barbara. It's not going to happen without the people staying involved.
From my point of view, I'm a physician, so all the support stuff when I get there is ready to go. And now we have so many people involved. We have scribes involved, blood pressure people involved, nurses involved, NPs involved. So it's a really large, complicated organization that works on volunteers.
I feel especially blessed when a homeless person recognizes me and knows me. I have a woman that I see on Sunday mornings at the Starbucks. They give her coffee at Starbucks on Sunday mornings, and I come in after church and she always waves at me. And it just, for me, it's such an important thing to be acknowledged, and because we don't talk about it a lot. I don't talk about it. Most people in my life don't know about this part of my life because it is special to me, and I don't share it other than with people who understand it and get it. And so I am changed forever. I look at each person as a child of God.
So much promise and so much hope that I see in this is kind of a new way of doing things. A way to touch people's lives in a very compassionate, humane, just meat and potatoes human kind of way. You know, for me, it's just basic practical stuff. You know, this is for all of what may sound like lofty ideals that we have. This is just so basic and human. I love it.
I think what I'd want the community to know is that when you walk by them, you don't have to give them a handout, but please just look them in the eye and please say hello to them, good morning, good evening, good afternoon. And certainly I recognize, as well as anybody does, that sometimes, like anybody else, this individual group can be difficult. None of us like to be approached by someone that's inebriated or on drugs and asked for a handout, but you can also politely say no. And I think that approach serves a lot better than to malign or yell or lose your temper at them. I'd like to think there's a better solution out there.
I'd like to see that we were able to help more people. Maybe we had more doctors, we were able to do more street rounds. I think it'd be amazing if we could collaborate with other organizations, maybe with Cottage Hospital, so that we can make sure that these people are getting the best care they can. We don't ask to be primary care docs. Or doctors that aren't asking to be primary care docs. They don't want to be, we don't want them to keep coming back to us. We want to make sure that they get into a system where they can get the best care possible. We do what we can, and we try to do the best job we can, but this isn't an ideal situation, giving out medical care in a park. This is an emergency situation where people need help. And so ideally, I'd like to see it that we were able to work with other organizations better so that these people can get the best care they can.
We've got about 8 doctors that we can kind of count on, and some come every week, some come every couple of weeks, some come once a month. We've gotten a significant higher number of nurses. We've gotten a huge increase in students that are very dedicated and very helpful. We didn't have a comms team. That has really opened things up for us. We've gotten a lot more publicity, and it just really feels like it's centered us a lot. We've also increased our supplies a lot. We've gotten different doctors that have different points of view on how to treat certain things. That's been very helpful. We've gotten different medications through that direction, and we've just become a much more professional organization.
I hope this is like a model for other places that, and I think like hopefully the hospital will understand completely that we're saving the taxpayers' money, we're saving the hospital money, we're taking care of patients before they get too sick. So I just hope that it will be sustained and we'll get more, as much community support as possible.
I volunteer because I get so much out of it. When my husband died and my life kind of fell apart, I had this enormous black hole that I just didn't know how I was going to fill. And Doctors Without Walls not only filled it, but it's just, the joy just pours out of me anytime I'm involved with it, which is most of the time. I do it all out of a sense of gratitude for what it's given me, and I'm just so grateful that I get to be part of all this.
So I think one of the greatest challenges for us is finding the time and finding the resources to properly do our jobs to the best of our ability. But I think that even though everyone is busy this year, I think that it's a testament to how much everyone is dedicated to the movement that this organization is run so well, that there's such a great culture of giving back, even in spite of everyone having full schedules and things like that. This is where a lot of people, this is where their hearts are.
I don't see things so much in terms of hierarchical structures as sort of formalized institutional structures. I see it more in terms of the human dynamics that are there, the heart of it, if you will. And the heart of this is good.
Well, I think we all have a lot to learn from Doctors Without Walls. I think when I certainly contrast it with how I've had to work in our program in Boston, where it's essentially a group of large academic teaching hospitals, here it's pretty much a community, a good community hospital, regional hospital, and a lot of private docs and people in private practice who I have virtually no exposure to, where I am in my isolated world. And watching how each of those practices is doing their own to contribute to this, I think is something that can be a lesson for many, many, many cities across the country, where the real workforce is in the private practices, the smaller practices, who can give a little bit of their time and open their doors to taking care of some of the poorer people. I know they all struggle with Medicaid and Medicare rules, but being able to, and I can certainly know as here in Santa Barbara, when a few specialists say, I'll give you a couple of appointments a week, and begins to open up the system so that the people outside really feel like they've got a continuity of care where they can send people to. I think that's a remarkable lesson that you've learned here in Santa Barbara and can be shared with many, many, many cities across the country.
How do I see the future of street medicine or Street Medicine Institute? I do think that all the medical schools should have it, every community should have it, and we should use this as a part of, almost like a fire department. If you don't have one, you're wondering what's wrong there. But I would love to see the institute itself, get to the level where it can meet its four major goals, which are to serve as an expert consultant to communities that want to start programs, to serve as a resource, a central resource for best practices, and to help other programs learn from each other.
Great concept when you think about it. Common ground, isn't that what we ought to be looking for? It's not, I think, even any one person's idea, really. It's that whole sense that collaboration is the way to work in all of this. And to me, it begins in the heart as much as anywhere.